Hello students. So today we are going to talk about the common respiratory diseases. Diseases that are related to the process of respiration and the organs that are related to the respiration. So these are basically the diseases that are related to that. The first and the most common disease that we see in the humans is the asthma. Okay, so asthma is a lung disease in which your airways get inflamed and produce the extra mucus. Usually, asthma is a genetic disease, like if it is in your parents or in your grandparents, so somehow it will be there in your generation, or let's say in you as well, or it might skip one generation, but it will be there in your genes. So, most of the times, if you have genetic asthma, I can say it will be transferred to generation, and then in certain cases what I can say is it is sometimes people are allergic to the dust or allergic to a lot of things that are there in environment like gases and all. So in such cases also you will find the asthma, which is like allergic asthma, I can say. But particularly in asthma, what happen is it is causing the inflammation, as you can see, which producing the extra mucus. So inflammation makes the airways swollen and narrow. Means the gas that are supposed to pass, which is oxygen gas, does not have enough space to just pass through it. Okay, this will starts triggering the coughing, I can say, the wheezing and the shortness of breath. Why? Because the oxygen is simply not passing, and your the air passage, I can say, is filled with the mucus. Now, if I talk about the common system that a asthmatic patients suffer, so it is the shortness of the breath, and it will eventually lead to the difficulty in breathing, the whistling or the wheezing sound while exhaling because of the production of the mucus within the air passage, and the chest tightness or pain and disturbed sleep, which is again due to the muscles that are involved in the process of breathing. Since you are not breathing properly, so the muscle will become tighten, and also diaphragm is also not working properly. Your lungs are not what you can say expanding or contracting properly. So all of these are the common symptoms. And what are the causes? Usually the causes would be the allergy, as I told you. Sometimes it could be the occupational reasons, like where you work. So sometimes the smell of a certain thing can also trigger the asthma, or the exercises which is also induced. Again, in terms of exercise, what you can say is it is sometimes a genetic asthma where it is like or affecting the person and causing the asthma attack. It may develop at any age because it again doesn't relate to the your whole lifetime. It means like it is not necessary that you will see the symptoms of asthma in a very earlier stage of life. Sometimes what happens is that people, they grow and then they start feeling asthmatic. So again, the age does not play an important part here. Asthma is triggered by the cold air pollutants and irritants and pollen dust, mites, mold spores, and the pet hair. These are like common things which can actually cause as an irritant and causing the asthmatic attack. Other than that, the things that can actually damage your air passageways is also the reason that can cause the asthma. What is the treatment for the asthma? So asthma cannot be cured. First of all, as I told you, it is a genetic thing. So it is very difficult to cure it, and only thing that you can do is to control its symptom. Means the things that can cause the asthma, you have to get away from it. And also the symptoms, as we have discussed, you just control the symptoms or the part of the body which is like actually involved in this process of, you can say, asthma. So again, it can be prevented by avoiding the causes which induce the asthma. Now, if I talk about different diseases as well, so there is a bronchitis, there is a pneumonia as well. So if I talk about bronchitis, it is the inflammation or swelling of bronchial tubes. Now, where are the bronchial tubes? It is just before the what you can say lungs. Like, so there are different parts, bronchi, bronchioles. So it is like the swelling and inflammation of any of that. Okay, bronchi or bronchiole. So it will basically the passageway that carry the air to and from the lungs, like oxygen is carrying inside and the CO2 is going outside. So what are the symptoms for the bronchitis? So it will include the coughing of mucus, wheezing, shortness of breath, and chest discomfort. I mean, what you can say here is the mucus is the number one thing that you will see as soon as the air passageway get irritated. because mucus is like involved to remove all the unnecessary dust. Okay, because the passage has to be clean. So that is a one common thing, and that leads to the wheezing and the shortness of breath at the end. What are the causes of the bronchitis? So it can be caused by viral infection. Okay, it can be caused by dust, air pollution, or some bacteria as well. It can also caused by smoking or due to some occupational hazard. Usually whenever we talk about occupational hazard, we are particularly talking about your working area where you are dealing with certain kind of chemical substances which can cause the bronchitis. Now if I talk about pneumonia, it is a bacterial disease, means it is caused by the bacteria. Okay, like if I give you one example, it is a Streptococcus pneumonia, which is one of the bacteria that can cause the pneumonia. And what it leads to? It leads to the inflammation of lungs and affects alveoli. Now, before this, the diseases that we talked about is affecting the parts that are other than the lungs, but this particular disease affecting the lungs. So the old people, the infants and the young children are more susceptible to infection. The reason is why they are susceptible to infection is because their immunity is not strong enough, and that is why this bacteria is able to penetrate and damage the lungs. Okay, now if I talk about the symptoms of pneumonia, so it was the cough with sputum, which may be with blood or like and rusty or green. If it is rusty or green, that will actually tells you that there is bacteria present inside your passage where like the colonies has been grown. Then the fast breathing and the feeling short of breath, shaking, chills, and the fever is also there if you have a viral infection. The chest pain during breathing and coughing and feeling of tiredness and the weakness is also there, because again it is affecting your what you can say, the breathing process, and at the end it is affecting your respiration. How you can diagnose the pneumonia? By doing the blood test and also the chest x-ray. What you can do for the treatment? You can consume the antibiotics, you can consume the cough suppressant, and also fever reducing medicine which can actually kills the bacteria. Then the last and the one of the most common diseases that we have found is the tuberculosis. Again, this is also an infectious bacterial disease. There is a point of time when this TB disease is like very common within the people. Okay, because of a lot of factors. But right now it is not as such common, and even though it is found in a lot of people, we have a very good vaccination available for that. So people are not getting what you can say, affected as much as they were affected before. So it is caused by this bacteria called Mycobacterium tuberculosis. Its symptoms are coughing, sometimes with mucus or sometimes with blood. The person might feel fatigue, and there is a low grade fever as well. There is a loss of appetite and the loss of weight as well. Now, usually, if you talk about tuberculosis, it is also the infection which affects the lungs, but this pathogen can also enter bone, brain, and kidney as well. That is why this disease is pretty much what you can say, very uh, damage causing disease, and that is why the vaccination is needed for such diseases. And how you can diagnose it? You can diagnose it by skin test, blood test, chest x-ray, and sputum test, which is like the cough that is produced. What is the treatment? Right now, as I told you, it is completely cured by the antibiotic treatment and the vaccination. And if you consume good and healthy diet, that can also help. How you can prevent it? Obviously, the spread of tuberculosis can be prevented in a society and in the areas by giving the BCG injections, as I told you, to the children and vaccinating them against the TB, which is like the most effective way to control the tuberculosis. So these are the common respiratory systems that we found in our environment. I hope this will help you. Thank you.